I'm Rachel Johnston with Philadelphia Magazine, and I'll be your host for tonight's web chat. This web chat is sponsored by Abington Health in partnership with Philadelphia Magazine. Our topic tonight is lung cancer screening and options for treatment. Throughout tonight's web chat, we hope that you learn who should be screened for lung cancer, the technology available at Abington Health to diagnose lung cancer, and the options for treatment. Tonight we're chatting with Drs. Gaughan and Sundermeyer, who specialize in lung cancer. Dr. Gaughan is a thoracic surgeon, and Dr. Sundermeyer is a medical oncologist, both at Abington Health. All right, Dr. Gaughan and Dr. Sundermeyer, before we get started, can you tell us a little bit about your background and expertise?
Hi, I'm Colleen Gaughan. I'm a native Philadelphian. I did my medical school and surgery residency training at Temple University. I did my first fellowship at the University of Southern California in esophageal surgery and a cardiothoracic surgery fellowship at the University of Miami. I've been in practice now for 5.5 years in the Philadelphia area, and I just joined Abington Health last year.
Hi, I'm Mark Sundermeyer. I'm a medical oncologist, and I'm originally from Missouri, where I went to undergraduate and medical school. I then moved to Philadelphia, where I trained in internal medicine at Temple University, and then did my specialty training at Fox Chase Cancer Center, and I've been at Abington Health now for 8 years.
So we're going to move on to screening questions. Who should be screened for lung cancer?
The current recommendations for screening on lung cancer is anybody between the ages of 55 and 74 years of age who has smoked at least 1 pack per day for 30 years and does not currently have any personal history of cancer or has a symptom that is concerning for lung cancer. Those patients would be eligible for a diagnostic test of their lungs rather than just a screening exam.
Since the program was implemented, what are some examples of ways patients have benefited?
So since the program started about 2 years ago, we've had more than 800 patients involved in either our screening program or our lung nodule program. And from those patients that became involved, we've diagnosed 13 early-stage lung cancers, and we found no advanced stage in those screened patients. And that is the purpose of the screening study, is to catch them early when the cure rate is much better than at later stages.
So what are some treatment options for lung cancer?
So treatment for early lung cancer, such as a stage 1 or stage 2, is surgery to remove the lung cancer itself and also the area of the lung that contains the cancer. That is considered the gold standard of therapy. However, that's usually only available to patients who have good functional capacity. That means they get around well, they walk well, they can exercise, and don't have severe COPD or emphysema. Surgery has gone through some advances that we can offer more surgery to more people. However, there are alternatives in treatment for people who may not be eligible for surgery.
What are those alternate treatment options?
So some of the alternatives are, if you have a more advanced stage lung cancer, like a stage 3 lung cancer where we think lymph nodes are involved in the middle of the chest, we often will start with a course of chemotherapy and radiation to shrink the tumor, which would then allow Dr. Gaughan to consider surgery following that intervention. For more advanced stages, stage 4, where the goals of treatment are to control the cancer, chemotherapies and molecular therapies are the current mainstay. And for those patients with earlier stage tumors that can't undergo surgery, we have focused radiation beams that we use, radio frequency waves that can destroy the tumor, and even cryotherapy where we freeze the tumor.
And from Bucks County, I've heard that you offer genomic testing. What is that?
So one of the big advances in lung cancer right now is determining, are there specific mutations known as driver mutations, meaning they're so important that the cancer can't grow without them. And so we sequence the genome, in this case, very specifically to look for known mutations that we can target. There are genomic sequencing that's happening where they look at the whole genome. That's really on the cutting edge right now and fairly experimental because we can identify mutations that we don't have a drug to target. But at this point, there are at least 3 to 5 known mutations in lung cancer that we can target with medications, and it really has become standard, and it should be offered at any institution. We definitely offer it at Abington Health in order to better focus our treatment and to minimize side effects, as molecular therapy is often better tolerated.
Thank you. Is it safe to exercise during a lung cancer treatment?
We actually encourage our patients to exercise around the time of their treatment and to maintain as much of their normal lifestyle as they can. Especially with minimally invasive surgery, you can return to your regular level of functioning much sooner. I encourage my patients to go out and walk immediately after surgery. In fact, the day of surgery, and sometimes the day of surgery, and definitely the very next day we have them up and walking. And by the time that they're home, they're able to walk around and do many of their normal activities. We want them to get back into their exercise program at about 2 weeks after surgery, no later. And it really does help to maintain not only their health during their recovery from surgery, but also their mental health.
And from a chemotherapy perspective and molecular therapy, fatigue is one of the big side effects of the medications that we use. And the only thing that's actually been shown to minimize fatigue from these treatments is exercise. And many times it's the last thing a patient wants to do is after they get home from their chemotherapy, get up and be active. But it's really worth it in the long run to keep living a full, active life if you can put in the extra time to keep active.
All right, Dr. Gaughan, Dr. Sundermeyer, that's all the time we have for today. Thank you so much for being with us and sharing all of your great insights on lung cancer screenings, on options for treatment. If anybody has further questions, you can contact Kelly Pressler at 215-481-LUNG at Abington Health. We want to remind everyone that our next chat is on Thursday, February 19th at 6 p.m. with Dr. Fireman. He'll be educating us on how we can prevent heart disease. You can sign up and ask your questions ahead of time by registering on www.abingtonhealth.org/healthchats. Thanks.